Welcome to the world of anesthesia CPT coding. Anesthesia in CPT medical coding involves the administration of medication or other agents to induce a state of temporary loss of sensation or consciousness during medical procedures. Proper documentation, accurate coding, and adherence to coding guidelines are essential for coding anesthesia service effectively. Welcome back to my YouTube channel. If you are new to my channel, welcome to MadCode Insight. Hi, I am Nushaba, a certified medical coder. Today we delve into anesthesia CPT guidelines, shedding lights on crucial aspects that every medical coder should understand. Let's navigate through the guidelines that ensure accurate reporting of anesthesia services. But before we dive in, if you haven't already, make sure to subscribe or stay updated to our medical coding series. Now let's embark on our exploration of anesthesia CPT guidelines. As we know, CPT is divided into three main categories. Category 1 of the CPT is divided into 6 sections. In this video, we will dive in one of these sections, especially focusing on anesthesia codes. Let's shed light on some important points to remember. Administration of anesthesia are reported by use of anesthesia 5-digit procedure codes 00100201999. It is also known as zero series code along with modifiers. Anesthesia can be given by anesthesiologist, surgeon, certified registered nurse anesthetist, or student registered nurse anesthetist. The reporting of anesthesia services is appropriate by or under the responsible supervision of a physician. Anesthesia services include the usual preoperative and postoperative visits, the anesthesia care during the procedure, the administration of fluid and blood, or usual monitoring services like ECG, temperature, blood pressure, oximetry, capnography, and mass spectrometry. Unusual form of monitoring like intraarterial, centrovenous, Swan gains are not included. Moderate sedation or conscious sedation. It is a drug-induced depression of consciousness. To report moderate sedation, we will use code range from 99151 to 99157 series. To report regional or general anesthesia provided by a physician also performing the services for which the anesthesia is being provided, we will use the modifier 47 along with service or procedure code. An anesthesia code should not be used along with modifier 47. Components of anesthesia guidelines. Anesthesia guidelines include time reporting, anesthesia services, supplied materials, separate or multiple procedures, unlisted service or procedure, special report, anesthesia modifiers, physical status modifier, qualifying circumstances. Let's discuss these components one by one in detail. Let's first discuss about the time reporting. Anesthesia time begins when the anesthesiologist begins to prepare the patient for the induction of anesthesia in the operating room and ends when the anesthesiologist is no longer in the personal attendance, that is when the patient may be safely placed under the post-operative supervision. Anesthesia time units are calculated on base of total duration of anesthesia services provided, rounded up to the nearest 15 minutes increment. Each 15 minutes increment of anesthesia time corresponds to one anesthesia time unit. Anesthesia time units are an important component of anesthesia billing and are used to determine reimbursement for anesthesia services. Proper documentation of anesthesia starts and stop times is essential for accurately calculating anesthesia time units and ensuring compliance with coding guidelines. Let's understand with an example. A 63 years old patient is taken to the operating room for the planned surgery under general anesthesia. The anesthesiologist began preparing the patient at 10:15 a.m. At 10:30 a.m., the patient is induced with anesthesia. The surgeon begins the procedure at 10:45 a.m. and completes the procedure at 11:15 a.m. The anesthesiologist monitors the patient until 10:30 a.m. and he releases the patient to the nurse for post-operative supervision. At 11:45 a.m., the patient is fully alert and taken to the ward. What is the total time should the anesthesiologist charge for? And also calculate the time in unit. Let's calculate the anesthesia total time and also the time in unit. In the given example, different time represent different steps before, during, and after the procedure. As we know, anesthesia time begins when the anesthesiologist begin to prepare the patient for the induction of anesthesia and ends when the anesthesiologist is no longer in personal attendance, that is, when the patient may be safely placed under post-operative supervision. In the given example, the anesthesiologist began preparing the patient at 10:15 a.m. and at 11:30 a.m. he releases the patient to the nurse for post-operative supervision. So the anesthesia time duration is from 10:15 to 11:30, means total time is of 1 hour and 15 minutes. As we know, each 15 minutes is equal to one anesthesia unit. So for 1 hour 15 minutes, total anesthesia unit will be 5 units. Next component of the anesthesia guideline is anesthesia service. Services rendered in office, home, hospital, consultation, and other medical services. These services are listed in Evolution and Management Service section. Special services, procedures, and report are listed in Medicine section. Next component of the anesthesia guideline is supplied materials. Supplies and material provided, for example, tray, drugs, over and above those usually included with the office visitor. Other services rendered may be listed separately. Drugs, tray supplies, and material provided should be listed and identified with 99,000 series code or the appropriate supply code. Next component of the anesthesia guideline is separate or multiple procedures. When multiple surgical procedures are performed during single anesthetic administration, the anesthesia code representing the most complex procedure is reported. The time reported is the combined total of all procedures. Let's take an example to understand it. What qualifying circumstances code should be added to the procedure code for a patient who became significantly hypotensive during the procedure, causing an emergency condition? In the given example, there are two qualifying circumstance codes, one for hypertension and second for an emergency condition. Qualifying circumstance for the code of emergency condition is more complex than for the hypertension, and it should be added into the procedure code. So our answer is 99140. In the next video, we will cover the remaining components of CPT anesthesia guidelines. If you have any question or need further clarification, feel free to ask in the comment section or reach out via email. Thank you for watching. If you enjoyed the video, please like, share it. Your support means a lot to me. If If you haven't already, consider subscribing for more. Click the bell icon to receive notifications. For more detailed guidelines, CPC mock or exam related questions and notes, email me at my giving email ID.